A number of years ago, I made the videos that are, the bulk of the library. And I tried to capture everything that I thought was important, both from my clinics and what I kind of taught there, and also things that I learned that I thought were applicable for the internet sites that we provide the support for. And one of the videos that I did, it was titled, "Is This a Symptom of Quitting Smoking?" And I can't remember for sure if I was going to include this section that I'm bringing into it now, or if I just forgot, because it was kind of funny because at the tail end, when I was kind of wrapping up that video, the phone started ringing. I remember it was John, and I saw it, so I was letting it go, and I just wrapped it up really quick. So there's this one annoying video that at the end the phone is just blasting away in the background, and I wrapped it up really quick, with a quick never take another puff. And what I did cover in that video was how I address symptoms in the first few days of a stop smoking clinic. Because I was very careful about how I discussed symptoms in the beginning of a clinic, because I didn't want to create the symptoms in people. I didn't want to say that it caused headaches. And does quitting smoking cause headaches to a lot of people? Well, sure it does. And I went into the reason why on one of the videos on blood sugar. And, there's a few things you can do to help certain symptoms. But the first day of the clinic, I would never really want to say that, because not everybody was going to get it. And I didn't want to create this situation where I was going to set up a self-fulfilling prophecy. One area that I didn't cover, though, and one that is extremely important, and specifically for the internet site, for the Freedom site, or for people coming in from Why Quit, and it's where people are asking, is a symptom that they were having, a week into their quit, a month into their quit, months into their quit, and sometimes, oh my God, years into their quit. Oh my gosh, something is happening. Is this a symptom of quitting smoking? And there's a lot of people who just automatically write off everything, every emotional feeling they have, every bad ache and pain that they have, problems that happen at their office. They're writing it off to somehow that they had quit smoking some time ago, and this just can't be a normal reaction. One of the posts that I kick up often when people do, write down something is happening, at a time period, is life goes on without smoking. And that's an extremely important string, trying to get this point across that, yeah, the first few days, blame symptoms on not smoking. As long as they're not symptoms which are life-threatening. Again, I don't want people writing off a chest pain. I don't want people writing off, they all of a sudden go blind in an eye to, oh, this is a symptom of quitting smoking. No, some things are not symptoms of quitting smoking. They're symptoms of serious issues that need to be checked, and not to be written off that just because they quit, let's write it out and see what happens. So in the beginning, even the first few days, you don't want to write off all symptoms. But I do tell people, if they're having minor irritations or problems in the first few days, it's probably from not smoking, probably. And if it's nothing that serious that would normally cause you to go, to a doctor or to an emergency room, maybe, okay, then you can write it out and see. If it does go away in a few days, well, then it probably wasn't from not smoking. It was probably something else going on concurrently that, you want to get checked out so it doesn't drag out now for, indefinitely. And that's the problem that I have on the internet when people write, I'm having this symptom, and somebody else will come in who maybe quit at the same time, or maybe quit a long time ago, who had a similar symptom that went on for a while and got better, and they'll automatically write that in, thinking that this is really a good service they're doing to make this person feel better about the symptom. The problem is, they may not be having a symptom from quitting smoking. They may be having a symptom of something else and writing it out when there's no real reason for its resolution. In a case where somebody has a throat infection, they have a bacterial infection, and somebody else, when they quit smoking, had a sore throat, and they say, oh yeah, it got better in 3 days or so. But now you're telling this to a person who doesn't have a sore throat because of nerve regeneration, but has a sore throat because of a bacterial infection. It's not going to get better in 3 days. It's not going to get better in 3 weeks if it goes untreated. It's going to get more and more serious if it goes untreated. If, again, there was another underlying condition causing it. So this video is almost it's for two purposes. It's for a person who is having a symptom weeks or months into their quit, who is writing off the symptom, to say, don't do it. Don't write off symptoms. Don't assume everything that's happening is because you quit smoking. Again, life is going on without smoking. You got sick when you were a smoker. People get sick when they quit smoking. People who never smoked a day in their life will have times when they're sick. And if there is some sort of, symptom which is indicative of an illness, you want to find out what the cause is and not write it off to not smoking. But the other group that I want to address this to are people who are responding on an internet site. It's one thing to say that, when I quit smoking, I had a similar symptom at that stage maybe. It did get better, but, and again, emphasizes this information the way I'm emphasizing this information, but you understand that, it could have been something else. And, if there's a question at all, it is something that should be checked. Okay. And again, if you're responding to someone who's off for a few days and having symptoms, that's probably okay. But never if it's a point where it's going, into weeks or months, let the person off the hook of seeing their doctor, because that's what you're doing when you're saying, oh, I had this thing, but it got better, because it may not get better. There may be some other problem that needs attention. This isn't only true for physical symptoms. I try to make that very clear also in many of the articles that I kick up, but also for emotional. When you're hearing a person who is saying they're really depressed on the board, and then you come in with a comment saying, oh, I was depressed at this point in time, but I'm better now, and I did nothing to make it better. You're telling that person to write it out. You do not know the severity of that depression that person is feeling. And again, this depression that they're feeling, especially again if it's going on weeks, this may not be a symptom of quitting smoking. Or it may have been caused by their quitting smoking because maybe smoking was interfering with the medication they were taking to treat their depression, and it was making it more effective at a lower dose, and maybe they need a different dose. Maybe they were just self-medicating themselves all along, and now when you pulled nicotine out of the equation, these people may need treatment. They may need help. So just saying that, oh, it got better for me, you don't know it's going to get better for them. And you don't know that you are basically giving them a false hope and making them avoid getting help sooner. And that is nothing we want to happen at the board. We can control it somewhat at our board. We can, we see stuff like that. We'll kick in our commentary. We'll make it very clear, that it's giving medical advice, don't do it. And if it's blatant enough, we can remove it. I see this a lot of other boards too. And again, I get horrified sometimes when I see the commentary being made and no one following it up, but we don't have control over other boards. We don't, okay? So if you are participating in other boards, really think before you write. Do you really know exactly what this person is feeling, what this person is saying, the severity, again, of a physical or an emotional symptom? And, would you want someone telling you, if you had something really wrong that, it'll get better, if it wasn't really going to get better, if there was another cause that needed treatment, that needed some sort of true medical intervention. So the first few days, summing up here, many symptoms are common symptoms. We have videos on that. We have strings on common symptoms. And if you want to go look at what some common symptoms are and see if maybe you fall into those categories, yeah, maybe you're having that kind of symptom. But if it's a symptom, which again is something that could be indicative of something immediate and something serious, you still want to get it checked. If it's a minor aches and pains or minor complaints, and you're getting certain reactions that many people have when they quit smoking, yeah, it's probably from quitting smoking. There are reactions that people have, but again, those symptoms normally improve within a relatively short time period, within a day or 2 or 3. Things going longer, you got to be more discriminatory on of what you assume, of what this is quitting smoking or not. But anything going longer, anything going, again, into your second week, into your third week, into the rest of your life, don't write it off to not smoking anymore. There's been a number of times where we saw people who, they had done this even though they were encouraged not to, but when they finally went to the doctor, they found out they had, a thyroid condition, a blood sugar condition. They had other, serious issues that if they were addressed sooner, they would have got it resolved quicker. All right. I don't remember any case where anyone had any real long-term, serious, life-threatening implication by not seeking treatment. I'm not saying it didn't happen. I'm just saying I don't remember, per se, where anybody came in with stuff like that. But there were a number of times where people needed true medical treatment to resolve a problem that they had. And they had made the decision not to do it because they just quit smoking. That was the reason, and it wasn't. So, again, the word for warning here on that one concept: do not sit and listen to what happened to other people and assume that you're going to have that same reaction, or that same reaction that you're having is because you would quit smoking. Don't make that assumption in any case, and don't let anyone make that assumption for you either. If you have questions, get it checked. So again, I'm going to basically have to title this one the same thing, but hopefully direct it right when people, put in the commentary of, asking, has anybody else experienced this symptom? And this will be the more, standard response for people who are off, significant time periods having any kind of reaction. The way to reduce your risk of future illnesses is still the same. And, again, it doesn't take away what may be caused from other issues. It doesn't take away things that may have happened already that still need to be treatment, but the way to avoid having to deal with future problems that smoking could have caused is still sticking to your personal commitment to never take another puff.